In 2013, Florida law required all newborns be screened for critical congenital heart disease.
If a baby's not caught in time, a cardiac arrest or cardiopulmonary arrest could occur.
Minutes after birth, the baby should develop a pink pigment.
Sometimes you will see a little bit of blueness around the lips or blueness of the fingertips. But if the entire baby has a dusky blue color, that is abnormal.
He says the blue color indicates the baby's blood cells are not getting oxygen appropriately.
Usually this happens when there's what we call a critical congenital heart defect, where the anatomy of the heart prevents blood from going to the lungs appropriately.
If this happens while the baby is still in the hospital, experts will immediately run tests to determine what's causing the baby to be blue. But there are times where the symptoms occur after the baby leaves the hospital.
In the first days and weeks of life, there are certain vessels that close, and they may be vessels that the baby needs to stay alive and get appropriate oxygen levels.
He says if the baby is breathing fast, sweating during feeding, and has a dusky blue color, it's important to get immediate medical help.
This will usually require some type of intervention, whether immediately in the first weeks of life or something that we can wait later on and treat on an elective basis.
Children are at risk for blue baby syndrome from birth until 2 months old. Experts say the cause will determine the child's treatment. For Lee Memorial Health System, I'm Lindsay Fry.